Good day and welcome to 15 Minutes with Longevity. I'm Giselle Wertheim-Ames and I'll be your host for the show. This week we have Dr Tshidi Gule, who's from Medispace Wellness Institute, joining us in the studio, as well as Professor Michael Herbst. He's the head of health from the Cancer Association of South Africa. Now, the legal state of marijuana for personal and medicinal use is one of the most controversial policy issues at the moment. In the US, in Colorado, it's the most recent state to declare marijuana as legal. So we're going to take a look at how this could affect South Africa, as well as the pros and cons of the legislation of marijuana in South Africa at the moment. I'm going to firstly start with you, Professor Herbst. And funny enough, I was recently in Colorado on the day that they actually legalized its use. And everywhere you went, in the shops or in the taxi, people were actually speaking about it. Very positively, I have to say. And yet I think, rightly so, it is a very controversial area. Can you maybe contextualize for us why this is happening in the US? Why are they legalizing a drug which we understand to have some pretty hectic side effects?
It's interesting, you know, we've never really gotten behind the whole story, because all of a sudden, I mean, it's always been illegal. It's one of the first questions they'd ask for of a new president, that, you know, the incumbent, say, have you ever inhaled, you know? And yet all of a sudden they had this change. I think there was a lot of pressure from people, because the population would say, you know, we know that it can help with pain relief, and it can take away anxiety, and it may even assist in some forms of depression. And I think the pressure just became too much, and they decided, well, let's give it a go.
Okay, so that is happening in the US and other countries in the world. So, Dr. Gule, I mean, do we
Uruguay,
see evidence?
I know that they're going to have theirs officially legalized in April this year, but the president definitely has also decided to give it a go in his country. And there, I think the focus largely is to curb illicit drug use and to try and kill the drug rings. So I think every country and every state,
so that's a different reason. I mean,
seems to have a focus when it comes to the legalizing the substance.
So really, I mean, we look in the context here of health, and what are, so we spoke, you mentioned that it can be associated with pain relief. I understand if you are an HIV positive patient or a cancer patient, it helps with the side effects of nausea and vomiting.
It also helps to stimulate appetite.
Yes. Okay.
It also helps, it's antispastic in certain instances, and it may help for certain forms of epilepsy.
That's correct.
And
so those are it, but under close management, I'd assume. So where they have legalized this, it's been done under doctors' orders and with close management of it.
Yes, but the problem is, you know, how do you control it? Because very interesting, about 2 days ago, it was made known that in the states in America where marijuana use was decriminalized, the incidence has increased by 30% of children under the age of 9 admitted to the emergency rooms.
Surely not
because
smoking
having
it.
ingested cannabis in the form of biscuits and salads, because people, this is where they put the cannabis. They don't necessarily smoke it.
Okay, so they might be eating it or baking it.
Yeah, put cookies there and the children will eat them.
Which is an easy way anyways that, you know, cannabis can be ingested
so
as
why
well.
is, okay, so let's talk about that. Why would that be bad? And I'm not trying to be facetious here. I don't have an agenda.
Well, Giselle, in summary, you know, cannabis has been listed as an illicit drug for a reason. In terms of the National Drug Council and what we look at from a pharmaceutical point of view, you've got to look at the pros and cons of every single substance in order to decide where it belongs. Cannabis belongs in the negative category for the reason that a lot of people use it differently, and you've got to look at the effects that it can have long term. Such as because it's a bronchodilator, it can really wreak havoc on a person's lung by eroding the lining of your upper pipes known as tracheae and your lower pipes known as bronchi. You can result in lung disease. We know that it's also linked to a higher incidence of cancers like cancers of the throat and the neck. And of course, if you've got poor lungs already, cannabis and long-term use of cannabis can really result in you having lung failure.
So which say if you're a healthy person. So if you're a healthy person.
Yes, absolutely. Okay. But very recently, even in healthy people, there has now been, they found a link between long-term cannabis use and testicular cancer.
Okay.
So that is another very, very negative side of cannabis.
Okay, so if you're a healthy person, I mean, the debate around this issue, there are two debates. I mean, it really is an illegal drug. If you're a healthy person, you should not be imbibing. This is an illegal drug with consequences that are not very healthy.
Correct.
if you are an HIV positive patient or in a final, I mean, maybe not even a final stage cancer, is there a difference if you're in your early stage cancer or to stage 4, whether or not is this the only substitute you could have to relieving those symptoms?
Definitely
or are there
not.
other ways that...
We have so many other drugs that are freely available that are just as effective. So we don't have to go to another substance with all its problems linked to it.
But would it, and I'm again trying to understand why this has been such a shift, because it is quite major.
A dramatic
happening.
shift.
It's dramatic, and
sure.
you know, it's seen. I mean, it is a recreational drug. Is it because that a cancer patient or an HIV cancer patient, who feels that they don't have long to live, could be in a much calmer and nicer state than if they were on morphine, for example, or one of these other drugs that deals with pain?
I think if you look at the pharmacological action of any of the drugs that deal with pain management for terminally ill patients, you could easily argue that the results that you can get from a cannabinoid-based drug is very similar to an opioid, something like morphine. I think most of the problems that come under this kind of debate is whether people are getting therapeutic doses of these pain killers of any kind. And so people who aren't well managed in pain management could easily jump to the conclusion that something like a cannabis would be better tolerated and better managed. And science really does try and find the best ways of delivering pain management drugs. But societies are different, and I think before you introduce any legislation for a new substance that you know has a really huge abuse history in any society, you've got to really consider, aren't there other alternatives? And now reality in South Africa, there still are. There aren't drugs that are failing terminally ill patients. It's whether or not the delivery and the management of people's pain is optimal or not.
And are those drugs cost effective, for example? So it's not a cost issue.
It's not a cost issue.
Okay.
But the other very important aspect is when you take cannabis in its basic form, you cannot control the amount of the cannabinoids that are taken in, because the concentration in the different types of plant is so totally different.
Yes. Yes, the purity of the delivery of the different receptors, as we discussed earlier, that there is the inhaled part and there's obviously an ingested part. And the delivery in the bloodstream for those kind of substances cannot always, as correctly as Prof says, can't be measured in doses. And there has to be certain scientific models that are in place before you can release or decriminalize a drug of that nature.
Does this, I mean, does by introducing or making it legal have a greater, I mean, has the research, and obviously it's still early days in some of these countries, but is there any link to the actual illegal trade of it or more use of it amongst people who shouldn't perhaps be using? I mean, is there any evidence to support a negative side effect, of using it for medicinal use, or is it still too early days?
Well, you always run the risk of people using it that would, under other circumstances, not be using it. Now, even in the United States, where they've got medicinal marijuana available, the incidence again of young men, especially between ages of about 19 and 30 years of age, has increased dramatically of abuse of the medicinal form of marijuana. So if you now make the plant material available, I think many more people...
How does that differ, the medicinal to the plant, just technically?
Well, the medicinal, they remove the tetrahydrocannabinols from the cannabis, and then it's in a very pure form.
That tetrahydrocannabinol?
People refer to it often as THC.
Yeah.
That is the active ingredient that also causes the high when you take in...
So the medicinal one doesn't provide that big...
It does.
It does.
Okay.
It does, because it's the THC, but you can control it.
Okay.
Because so many milligrams per so many milliliter is always a constant.
Right.
So you can control the dosage. Whereas with the raw plant material, there is just no way that you can control. And this is why we've now seen that children, by eating the biscuits, get overdosed so quickly, because you don't know how much THC is in the biscuits.
Because of the service providers and the plant growers of the cannabis
they're certainly
plant.
not regulated by any stretch of imagination.
Not yet.
Oh, and they grow it for the highest THC levels, I can tell you, especially cultivated.
For the addictive quality.
Yes.
Now, is there a possible, I mean, is the South African Health Council looking at this area? Is there any moves to look at making medicinal marijuana legal in this country?
I'll tell you, as long as we have the current legislation, nobody in South Africa can look at it, because it is an illegal substance. And the street drug Act in South Africa, I think it's in a 1992 Act, says, you know, cultivation, possession, use, distribution, it's all illegal. And as long as that is in place, we don't stand a chance really of, I don't think anybody will even get permission to grow the plant material to do experiments. So it will have to start with legislation.
And Dr. Gule, do you think South Africa is ready for something like this?
I
put you on the spot.
I can only give a personal opinion there. I think when you just look at the general substance abuse personality, if I could call it, of our country, we definitely are not winning with the basic substances like alcohol and nicotine yet. I personally don't think we're not ready to have a discussion about legalizing the likes of marijuana, which has far more dangerous effects long term, and because there's a high addictive nature of our teenagers as well as our professionals, we really have to tread carefully when it comes to these kind of conversations.
And last word really to you, and I understand the Cancer Association does have an official standpoint on that. Maybe you want to elaborate on that?
Well, we say as long as it is an illegal substance, Cancer is not prepared to even really discuss the topic, because we cannot go against the legislation of the country. We are citizens of this country and we totally subscribe to legislation and the Constitution.
Great. Well, I think you pretty much summed it up. I mean, I think it's a really interesting subject. I think it's really going to be interesting to watch over time.
And it needs talking too.
Absolutely. I mean, you're really to put it out there and have the debate around it. One last thing. Do you get any do you come under any pressure around this? I mean, is there a groundswell, or do you think the average South African really is not on the radar?
No, they're all on the radar, and I'll tell you, they get very aggressive at stages. We've had to write a lawyer's letter to somebody who really was so nasty and sort of threatening towards Cancer and its staff.
Okay. Well, that's all for this show. Thank you so much for joining us to discuss this very controversial topic. Join us again next week for your weekly dose of health and wellness news. Stay well, be healthy, and have a lovely week.